My name is Caroline Praveen, and I'm excited to discuss multilingualism as a source of optimism amidst neurodegenerative diseases. But before we delve into content, I'd like to share a little bit about myself and my motivations for completing the work that I'll delineate today. I attend South Fayette High School in Pittsburgh, Pennsylvania, and outside of school, I'm heavily involved in endocrinology research at the University of Pittsburgh. And this summer, I was accepted to another competitive research program called the Hillman Academy. Through this program, I have been working on revolutionary macrophage and interleukin research. I'm also an EMT at my local fire department. So, why am I discussing multilingualism and neurodegeneration today? About a year ago, I founded a nonprofit named the Fluency Forward Foundation. And by working with organizations like Immigrant Services and Connections and JFCS, I've been focused on advocating for education in underserved areas globally and aiding local refugees with their English language and assimilation skills. With this motivation, I took skills in R programming I learned from my internship with Think Neuro to start analyzing any connections between multilingualism and neurodegeneration on a global scale. The results were astounding, and I can't wait to share them. Neurodegenerative disorders are those that result from neurodegeneration, which is the structural and thus functional loss of neurons. The most prevalent include Alzheimer's disease, which is a type of dementia where the death of neural connections causes memory loss, Parkinson's, in which nerves damage causes a drop in dopamine levels and thus tremors and stiffness, and motor neuron disease, where motor neuron interference poses a hindrance to voluntary movement. In these disorders, the brain's matter appears to shrink because neural pathways are disintegrating. Here's a comparison of a healthy brain and that of a neurodegenerated brain. These diseases not only diminish the quality of life for those affected, but also strain the families, caregivers, and medical resources of the nation. In many low and middle income countries, the healthcare infrastructure is not equipped to handle the rising prevalence of neurodegenerative disorders, making it even more crucial to explore preventative measures and supportive interventions. This is no small matter. There are an estimated 10 million new cases annually, which equates to a new case every 3.2 seconds. Moreover, this rate is expected to double by 2030, and the economic burden is $13 billion. On a seemingly unrelated note, 3.3 billion are multilingual, with numbers on the incline due to the increasing prevalence of globalization. So, how might these figures relate? The answer lies in the concept of cognitive reserve, in which engaging in demanding tasks strengthens neural pathways and creates a reservoir. Most tasks where the brain is actively engaged and making decisions improves cognitive reserve. One of the strongest contributors, however, is in fact keeping two languages separate and choosing the appropriate one in a given context. While subject to ongoing research, there is evidence suggesting at least a partial overlap in the brain areas and neural networks serving bilingual language control and executive functions. This is evidenced by recruitment of these same networks for linguistics and non-linguistic tasks. This was found to correlate to a 54% decreased risk of incident dementia and a delay in the onset and symptoms of neurodegenerative disorders by as much as 5 years. This delay is not a cure, but it provides a critical window of opportunity for individuals to maintain their quality of life and independence for longer periods. The brain's ability to switch between languages requires constant mental juggling, which strengthens neural pathways and builds a more resilient cognitive framework. So, using the Web of Science and RStudio along with my skills in R programming, I've analyzed such associations. In this graph, as the mean number of languages spoken increases, the incidence of Alzheimer's decreases on an exponential line of best fit. In these maps I've created, the lighter countries in the first signify a lower literacy rate and align with the darker nations in the second chart, which signifies a higher dementia rate. This trend is particularly noticeable in Africa and Asia. Furthermore, in South America, the countries with higher literacy rates have darker colors, and the majority of those same countries are given lighter colors on the second map to represent their lower dementia rates. Unlike most data suggests, however, the correlation between the number of languages and the prevalence of neurodegenerative disease cases is not a perfect trend. It is true that when compared to a bilingual patient, those who practice more than 2 languages were 3 times less likely to present with cognitive impairment. However, those who spoke 4 or more languages had the same decreased probability of developing cognitive impairment rather than having a substantially lower rate. Additionally, it's been proven that the age of acquiring multilingual capacities affects the protective value and power of the cognitive reserve, with it providing more protection for the brain the earlier one learns another language. It is crucial to note that the correlation between multilingualism and delayed neurodegeneration does not mean that multilingualism directly suppresses neuron loss. Although it's already been established as a primary contributor to cognitive reserve, we need to devote our time to investigating the influence of other neurally demanding tasks on neurodegeneration. However, multilingual identity will still be vital to adding to this undeniable correlation. By encouraging people to learn more than one language from a young age and celebrating linguistic diversity, we can help build stronger minds globally. This proactive approach could be especially impactful in low and middle income countries where healthcare resources are often limited and the prevalence of neurodegenerative disorders is rising rapidly. In conclusion, the intersection of multilingualism, global health, and neurodegenerative disorders offers a unique and powerful opportunity. By embracing linguistic diversity, we can strengthen our minds, improve healthcare services, and advance research to combat these challenging diseases. As our global population ages, it's crucial to recognize and make the most of our everyday superpowers. Thank you.